To welcome everyone today to July's Psychological Health webinar. Today it's being presented by Theodora. Theodora is a psychologist here at Psych Health, and she'll be talking to us today about a very interesting subject of mental health stigma in diverse communities. So culture, race, identity. And like I said, Theo's a psychologist at Psych Health, so you can speak to her anytime. She's under the EAP team. So Theo, without any further ado, can I hand over to you?
Thank you, Alex. First of all, good afternoon, everyone, and thank you for being here today. Today, we're going to be talking about mental health stigma. Before we begin, I'd like you to think about one question. This is more of a reflection, not necessarily something you need to share. But when you hear the words mental illness, what's the first thing that comes to mind? There's, no right or wrong answer. We all develop beliefs about mental health through our families, our culture, our experiences, the media, and even the people around us. And so the purpose of today's session isn't to judge those beliefs. It's to explore where they come from, how stigma affects individuals and communities, and most importantly, what each of us can do to reduce it. Mental health affects everyone, whether it's ourselves, a family member, a friend, a colleague, or someone in our community. Mental health is simply part of being human. Next slide. So, before we get into the stigma stuff, what is mental health? People often hear the term mental health and they immediately think about mental illness. But mental health and mental illness are not the same thing. The World Health Organization defines mental health as a state of well-being that allows us to cope with normal stresses of life, work productivity, building relationships, and contribute to our communities. In other words, mental health is something every one of us has, just like physical health. Mental health is dynamic. It changes throughout our lives and is influenced by many different factors. These include our relationships, physical health, finances, work, culture, and life experiences. It may affect us all at some point in our lives. And next slide. So before we talk about stigma, I'd like you to think about something. Imagine that tomorrow you were diagnosed with a health condition. You'd probably tell your family, you'd likely tell your employer if you needed time off for appointments. You'd probably have no hesitation picking up your medication from the pharmacy. Now, imagine instead that you were diagnosed with severe anxiety or depression. Would that feel differently? Would you hesitate before telling your employer, or, would you worry about what your friends or family might think? Would you question whether people would see you differently? And for some people, the answer is yes. And that's exactly where the stigma begins. Stigma isn't the mental illness itself. Stigma is society's response to it. The World Health Organization and the American Psychiatric Association describe stigma as involving stereotypes, prejudice, and discrimination that's directed towards people experiencing mental health conditions. These attitudes can influence how people are treated by others and how they come to see themselves. Stigma isn't always loud. Sometimes it appears in the things we don't say. A friend who changes the subject whenever mental health comes up. A parent who tells their child, we don't talk about these things outside the family. These moments may seem small, but over time they send a big message. The message becomes it's safer to stay quiet. And that's one of the reasons stigma is so harmful. Research consistently shows that stigma is one of the biggest reasons people delay seeking help. And it isn't always because the services aren't available. Often it's because people fear judgment. They worry they'll be treated differently. They worry that they may disappoint their families. They worry that others will see them as weak or unreliable. Some even fear losing their jobs if people discover that they're struggling. What's particularly important is that stigma affects everyone differently. The experience of stigma may be influenced by a range of different factors like culture, gender, age, religion, sexuality, previous experiences with mental health, and many other parts of a person's identity. We'll explore those influences later, but first, it's important to understand that stigma isn't just one thing. Next slide. Stigma doesn't always look the same. It can occur at different levels, affecting not only individuals, but also families, workplaces, and communities. The first type of stigma is public stigma. And this refers to the negative attitudes, stereotypes, or discrimination that comes from other people. For example, someone might assume a colleague with depression is less capable or tell someone experiencing anxiety to just get over it. And these beliefs can influence how people are treated and may discourage them from actually seeking help, from talking to someone. The second type is self-stigma. And this happens when people begin to believe those negative messages themselves. Instead of thinking, I'm going through a difficult time, they might think, I'm weak or I should be able to cope on my own. And interestingly, research shows that self-stigma, is associated with lower self-esteem, reduced hope, and lower likelihood of seeking treatment. The third type of stigma is family stigma. And mental illness doesn't only affect the individual, it can also affect those closest to them. Family members may worry about being judged, blamed, or misunderstood because a loved one's mental health condition. And this can make it harder for families to talk openly about mental health or to actually encourage someone to seek support. Finally, there's structural stigma. And this refers to barriers within the systems or organizations rather than individual attitudes. Some examples include having limited access to mental health services, workplace cultures where people don't feel safe disclosing their mental health concerns, or maybe even policies that unintentionally make it harder to access support. Although we've described these as four separate types, they often overlap. Public stigma can lead to self-stigma. Family stigma can, discourage self-seeking, help seeking, and structural barriers can make support even more difficult to access. Now, understanding these different forms of stigma helps us understand that reducing stigma isn't just about changing individual attitudes. It's also about creating environments where people feel safe. Next slide. Now that we understand what stigma is, let's talk about why it matters. So, stigma is much more than hurt feelings or than using the wrong words. It has consequences for people's lives. One of the strongest findings in mental health research is that stigma is one of the biggest barriers to seeking support. Many people delay or avoid getting help because they fear being judged, they fear being labeled or treated differently. And they may worry, about what family, friends, and colleagues will think, or how this may affect their relationships or their career, even. Think about this for a moment. If people judged you for having asthma or high blood pressure, would you feel comfortable telling others or even seeking treatment for it? Probably not. And so the same principle applies to mental health. When people fear judgment, they're less likely to reach out and they delay support, which often means these difficulties for them become even more severe before the treatment actually begins. So rather than being preventative, it's more so trying to tackle it when it has become more severe than it was to begin with. Stigma can also become self-stigma. So when people repeatedly hear messages like you're weak or just get over it or other people have it worse, they may begin believing those messages themselves. And instead of recognizing they're experiencing a treatable health condition, they start questioning their own worth. And so the effects of stigma extend beyond the individual. It can lead people to withdraw from friends, avoid opportunities at work or school, and stay silent even when they're struggling. Families may also experience shame and fear of judgment, making conversations within the home about mental health more difficult and sometimes delaying support for their loved ones as well. So, without sharing any personal experiences, and you can just add it in the chat if you're comfortable, do you think people often find it easier to tell someone they've broken a leg than to tell someone they're experiencing mental health conditions, a mental health illness? Can you go next slide? So we'll just letting
You would
everyone
never
know
say to
the
someone,
chat is at the bottom if anyone needs to use it. It's at the bottom. We'll just watch this TED Talk video.
with a broken bone, to just ignore their pain. That'll just pass one day. You would never say about someone who has cancer that they're just faking it. It's just all for attention. You would never say to someone in a wheelchair, just stand up. It's all in your head. You would obviously never say that to any of these kinds of people because they didn't ask for it in their life. It's not like they chose to put it in their life. It should be the same for any other sickness or disability. No one asked to put this into their life, so they can't just snap out of it. Unfortunately, many people with mental illness have been told at least once in their life, just snap out of it. Trust me, if I could snap out of my anxiety and my depression, I would have done it long before anybody had to tell me. My illness isn't physically visible to you. You can't look at me and tell that I've been diagnosed with anxiety and depression. I mean, you can't really tell anyone who's mentally sick. And that's why it's kind of doubted in our society, because you just can't see it. The only people who can feel it are the people who have it. They can feel the battle inside them. I try not to blame myself for my anxiety and depression. I mean, as I said before, I didn't put it in my life. I didn't ask for it. It's just a result of the neurons in my brain working kind of abnormally. Many people have it because of a childhood trauma, or just it runs through genetics. It runs through my family. A family member of mine has also been diagnosed with anxiety and depression. She also had postpartum depression after having her children. She was fine for a little bit, but almost 10 years after having her last child, she admitted herself into a mental hospital for suicidal thoughts. She made the beyond correct decision to go get help. I hope when I say mental hospital, you don't picture this. Because in movies and stuff, it looks more like a jail, like a torture chamber where patients look more like prisoners. Even when I was looking up pictures for my slides, I could barely find a picture of what a mental hospital actually looks like. And it doesn't look much different than any other hospital wing. It's light and bright, and a lot of patients really do get better. My family member, she would send us coloring pages. She would call us and tell us how much better she was doing now that she had full-on access to a therapist. It's been almost a year and a half since she's been released from the hospital, and she's doing better. She owned her own business for a while. She is doing great at a new job, and she has a family that loves and cares for her. She is one of the greatest people I know. She's strong, and I look up to her every single day. My relative was lucky to get the treatment that she got in our society. Our society is very judgmental when it comes to mentally sick. Society tends to ostracize those who say that they're sick by calling them just crazy or overreacting. So that makes people who are sick tend to want to hide themselves. I've always stayed quiet, and so has everyone else in my family. But I don't want to be quiet about my illness anymore. I shouldn't be afraid to tell who I am. So as I said before, I've got anxiety and depression. I was diagnosed with anxiety when I was in 3rd grade. I would kind of just cry, like all the time, for no reason, or at least no reason that seemed rational. So I spent a lot of hours in the guidance counselor, and then I finally went to therapy. And it's been great. I love therapy. I mean, who doesn't want to sit in a room for an hour to someone who has to listen to you talk? It's helped me so much. I mean, therapy hasn't really gotten rid of my depression and anxiety, but more taught me how to beat it, how to cope with it. For example, in my late middle school years and my early years as a freshman in high school, I had a lot of depression. I was kind of just not really sad, but more felt nothing, felt worthless. And I kept going to therapy, and my therapist taught me, you can deal with it. Your mental illness is just an old-fashioned supervillain, and you're a superhero. You can beat it to the ground. So that's how therapy has helped me. Unfortunately, society hasn't just stigmatized therapy, but it's also stigmatized mental illness. It's so common to hear people say, wow, I'm so OCD because that thing just isn't lined up properly, or wow, that's so retarded. People shouldn't be saying these. If you've never had anxiety, you don't know what it feels like to have the entire world crashing around you for basically nothing. If you've never had depression, you don't know what it feels like to feel worthless, so don't make a joke about it. In a world where 1 in 5 adults have a mental illness, don't say how depressed you are because your favorite TV show ended. And don't say you're gonna kill yourself and make tapes because your Starbucks barista didn't get your order correctly. It's not appropriate to say these anymore. TED is all about ideas worth sharing, and the idea I want to share with you all today is be nicer to people. I mean, it seems like such a basic message, but you never know what's going on in someone else's head. So just be nicer, and make sure if you know someone with a mental illness that they know you're not judging them because of their mental illness. When I wrote this talk, I thought, how much should I share about myself? Should I just say I've got anxiety? Should I just say I've got depression? It's all been really personal my entire life. But then I realized that's why I wrote it. I shouldn't have to hide who I am anymore. It's hard enough working with this mental illness itself. So I should be comfortable in my own skin, and so anyone else. Thank you.
So we've talked about what stigma is, why it matters. Now I'd like us to think about where some of the beliefs about mental health come from. Every one of us has a culture, and sometimes we hear the word culture, we immediately think of ethnicity or nationality, but culture is much broader than that. Culture includes values, beliefs, traditions, behaviors, and expectations we learn from our families, from our communities, from our religion, our life experiences. Whether we realize it or not, culture shapes how we think about emotions, stress, resilience, and asking for help. It influences the language we use to describe distress. It influences who we turn to when we're struggling. It influences whether we seek help, or we see seeking help as a strength or as a necessity or something to avoid. Research has consistently shown us that mental health is understood differently across different cultures. And there isn't one universal way of viewing emotional well-being, but instead, people's beliefs are influenced by their cultural background, their family values, and the community expectations. For some people, emotional difficulties are talked about openly. Other families, emotions may be considered private, and some people are encouraged actually to seek professional support earlier on. Others may first turn to family members, close friends, and trusted members of their community. And these differences don't necessarily mean that one approach is better than others. They simply remind us that people make sense of mental health through the lens of their own experience. Culture is not only associated with barriers, it can also be one of our greatest protective factors. Strong family relationships, close friendships, faith, shared traditions, a sense of belonging. These can all strengthen resilience and provide meaningful emotional support during difficult times for people. Next slide. We've explored how culture shapes our understanding of mental health, but culture is only one part of who we are. Every person has a unique identity shaped by factors like race or ethnicity, culture, language, gender, sex, sexuality, disability, socioeconomic background, and different life experiences. And these aspects of our identity don't exist in isolation. They interact and influence how we experience the world. including how we experience mental health and how we actually access support. In psychology, we recognize that mental well-being is influenced not only by what's happening within the individual, but also by their relationships. And this means that two people experiencing the same mental health condition may have very different experiences depending on their circumstances. An important factor is belonging. So feeling accepted, feeling respected, and connected to others is a fundamental human need and plays an important role in supporting mental well-being. On the other hand, experiences of discrimination, racism, or social exclusion can increase psychological distress and reduce trust in services, which may create additional barriers for people. Research with culturally and linguistically diverse communities also highlight that concerns about discrimination, confidentiality, and whether professionals will understand their cultural values can reduce trust and make people less likely to seek support. And that's the main reason why person-centered and cultural responsive care is so important. Rather than making assumptions, we stay curious, we ask respectful questions, and recognize that each person is an expert in their own lived experience. When people feel heard, respected, and understood, they're much more likely to engage with support and build trusting relationships. Next slide. Oh, we're already here. Yeah. So before we go any further, I'd like to make one thing quite clear. So when it comes to being lesbian, being gay, being bisexual, transgender, queer, or any other diverse sexuality or gender, identity is not a mental health illness. Major health organizations, including the World Health Organization, recognize that as a normal variation of human diversity. And research has shown that LGBTQIA+ individuals experience higher rates of anxiety, depression, and psychological distress. However, it's important to understand why. The evidence tells us that these poorer mental health outcomes are not because of a person's identity. They're largely associated with the experiences such as stigma, discrimination, bullying, rejection, and fear of not being accepted by family members or workplaces. And this often is explained through minority stress theory, which recognizes that ongoing exposure to these stresses can have a significant impact on mental well-being. Next slide. So we're just going to have a poll, Alex.
Okay, that's me. Oh no, where's the poll gone? Sorry, excuse me. Poll, here we go. Can you see that?
So, yeah, I think you just press it. Yeah.
Yep.
What aspects of who you are have had the biggest influence on how you think about mental health or asking for help?
So if everyone just clicks on the answer, I'll give you an update on the scoring and how we're going. So culture, family values, life experience so far are getting a few hits. More on family values.
Interesting how it's...
life experience is now getting a few more numbers. So the winners so far, family values and life experience, with a little bit on culture.
Very interesting. And next slide, I think. So when many people think about stigma, they may imagine obvious discrimination. Someone, refusing to employ a person because they have a mental illness, or someone making offensive comments. While those situations certainly occur, they're actually not the most common ways stigma appear. More often, stigma is subtle. It shows up in everyday conversations, in assumptions, body language, behaviors, and sometimes we don't even realize we're doing it. For example, imagine a colleague saying, "We're taking leave because, I'm experiencing some anxiety." A response might be, "Take care of yourself. Let us know if there's anything we can do to support you." Another response might be, "Everyone gets anxious. You'll be fine. At least it's not something serious." And although those comments are often well-intentioned, they can unintentionally minimize the other person's experiences. So rather than feeling understood, the person may feel dismissed. Sometimes stigma appears through the language that we used. We might often hear someone, described as being crazy or psycho or mental, or people just saying, I'm so OCD, I'm so bipolar today. And these expressions have become common in everyday conversations, but they reduce the complex mental health conditions to stereotypes or to jokes. And language matters because it shapes the way that we think. Over time, repeated messages influence social attributes and can reinforce these negative stereotypes. Stigma can also appear through assumptions. For example, assuming someone with depression isn't capable of leadership, or assuming someone with anxiety can't cope under pressure, or assuming someone that's seeing a psychologist must be really unwell. But the reality is that many people experiencing mental health challenges continue to work, continue to study, continue to parent, to volunteer, and to contribute to their communities every single day. Next slide. So we've spent a lot of time talking about stigma. We've explored what it is, where it comes from, how it affects individuals, families, communities. And the encouraging news is that stigma is not permanent. Research tells us that attitudes can change, communities can change, workplaces can change, and every one of us can contribute to that change. One of the strongest findings across decades of research is that education matters. The more people understand mental health, the less likely they are to rely on stereotypes or misinformation. Another powerful strategy is simply talking openly about mental health. For a very long time, mental health was something people whispered about or didn't talk about at all. And silence reinforces stigma because it creates the impression that mental health is something shameful or something that should be hidden. But every respectful conversation helps to normalize the fact that mental health is part of overall health. Research has also told us that one of the most effective ways of reducing stigma is meaningful contact with people who have lived experience. When mental health remains an abstract idea, it's easy for these stereotypes to develop. But when we hear someone's story, whether in person, video, or we start to begin to see the individual rather than labeling them to that mental illness. And language is another area where each of us has influence. The words we choose either reinforce stigma or they reduce it. For example, saying a person living with schizophrenia rather than a schizophrenic reminds us that a diagnosis does not define a person. Another important highlight is the importance of creating environments where people feel psychologically safe. That means workplaces where our managers, our supervisors, our leaders speak openly about mental health. Healthcare services that are culturally responsive, schools where students know where to access support, how to access support. Communities where asking for help is viewed as a sign of strength rather than weakness. Sometimes we think reducing stigma requires a large campaign or, organizational change, but they help. But many opportunities happen in just everyday, ordinary conversations. Next slide. So if we're to think about, imagine a colleague telling you that I've been struggling with my mental health lately. What's the best and first thing you should say?
Gee, we should have done a poll on this. This is
Probably not one of the first three. Yeah, that's a really good response. Very thoughtful, very empathetic, very understanding, Claudine. Amazing, amazing. Thank you for interacting. Those are very good responses. They're very empathetic, very reflective as well, and very considerate. Next slide. So as we come to the end of today's presentation, I'd like to leave you with something practical. We've spent the last half an hour talking about stigma and the importance of creating supportive environments. But reducing stigma is only one part of promoting mental health. The other part is recognizing that mental well-being is something we actively nurture throughout our lives. Just like our physical health, our mental health benefits from regular care, and regular care not only when we're struggling. Some research shows some habits that help protect our mental well-being and build resilience. These habits start with looking after our physical health through quality sleep, regular physical activity, and good nutritional support. Staying connected, building strong relationships with family, friends, colleagues, or our community, which assists in providing support during difficult times. Self-awareness also plays an important role, so recognizing changes in our mood, stress levels, or energy levels, which allows us to respond earlier rather than waiting until we've become overwhelmed. And we also need healthy ways to manage stress and recover. Recovery looks different for everyone. It might be exercise, spending time in nature, or hobbies. Just some time for simply making time to have that reset for ourselves. And finally, having a sense of purpose. Whether we walk through life, whether we walk through work, volunteering, faith, or helping others, these can strengthen our resilience and our overall well-being. Just as we don't ignore our physical health, we shouldn't ignore our mental health. And next slide. When these lifestyle changes/support isn't enough, and you start to experience some symptoms that have persisted for quite some time, or the stress starts to become overwhelming, or you see these really big changes within your life, maybe it's time to reach out and to speak to someone. More so for getting that practical support before it becomes even more difficult or overwhelming. Next slide. So at Psych Health, you have access to mental health psychology sessions. And these are confidential sessions that are covered by your employer. So your employer is not aware that you're accessing these services. They're not aware what you're discussing during these sessions. And you have access to quite a few resources as well. Thank you, everyone. These are just some ways to access our services.
Thanks, Theo. Hey, Icy, could you go back to the QR code screen, just in case people wanted to snap any of those? Theo, I wanted to thank you once again for a wonderful presentation. And to everybody, we're nearly out of time, but I just want to say that a recording of this presentation will be circulated in the next newsletter, as well as all the presentation material. If anyone wants to hang around and ask a few questions, we're here for the next few minutes. But look, I just want to thank you all for attending, and thanks, Jen. I'm going to kick off a question. Feel free to leave now, but I'm going to kick up a couple of questions, and if you've got anything, just throw it in the chat box. Theo, your definition of stigma was awesome, like society's response. I thought that really framed it well. My kids, who are all grown up now, but I was stunned by the fact that when they were going through school as teenagers, mental health wasn't a big drama. It wasn't a big stigma like it was, in my generation. It was just like a cold or a broken arm. And so my question is stigma reducing with, these new generations of millennials and Y-gens and so forth?
I would say yes, definitely. More so associated to their parents. So you probably coming out of that generation where there was big stigma around mental health, people start realizing that they can get support. They realize that they don't have to keep quiet. They don't have to keep within their families. And so realizing that support is accessible and easily accessible, especially for the younger generations. I know they have a lot of access at schools with mental health.
Yep.
So I would say accessibility has grown, which in turn has also reduced the stigma.
Yeah, I just noticed it was quite a revelation to me, the kids didn't have that that stigma, you know, when their friends were seeking counselling and so forth. So I was quite encouraged by that. Does anyone have any questions they want to throw in the chat box? I'm just going to open mine up now to make sure. No, I think that's all. Look, thank you once again, everyone, for attending today. Thank you, Theo. Thank you, Icy, for doing all the tech work behind the scenes. And we look forward to seeing you all next time. Bye for now.
Thank you.